Hello everyone. Welcome to Need to Doctor. We are starting with one of the most awaited series, that is Pathology Microscopic Practical Slides, and gradually we will also move on to the gross specimens chapter wise and how to present them in the Viva. So the first and the most basic slide you will get is of fatty liver. So if we see the microscopy, this is the basic slide you will get. So here we can see, if I zoom onto it, here you can see some big oval structure with some cells around it, right? So it is a central vein. Now when you find some vein or artery like structures, basically something which has lumen, after that you have to find um, you have to rule out whether it is liver or not, because liver is a very common slide. Then you can see this triad, 1 2 and the third structure, like basically three lumens together is a triad, that is the portal triad, whenever you will get it in pathology slide. So when these two structures are there, you know it is a slide of liver. Now here are multiple fatty macrovesicular and microvesicular fatty cells. So microvesicular is basically when a cell has multiple fat droplets, and macrovesicular is when there is one large fat droplet which is pushing the nucleus towards the periphery. Here you can see the macrovesicular and it is the microvesicular, like this, right? So distension of the entire cytoplasm of most of the cells, nucleus to the periphery, and after that you are having the cells containing fat rupture and then produce the fatty cyst. Fatty cyst may or may not be visible in the slide. Now we can also see the centrilobular hepatocytes are mainly affected here, and the peripheral ones are less affected. So here you can see the portal triad more clearly, 1 2 and third one, right? Next we are having the diagram. The diagram is very simple. This is the normal part and this is the fatty liver part, right? These are some of the more pictures. Further you can also see this gross specimen. Here the liver is enlarged, yellow, dense glistening capsule is there and rounded margins with cut surfaces are like rounded and like it is bulging. Also it is pale yellow and greasy to touch. We don't have to speak like greasy to touch in the Viva because we are not touching the specimen actually. Here I have taken it from some online platform, but you can also refer to it. There are other stains as well. This is a Viva point. What are the other stains? Or it is an OSPI point. Other stains which are used to see the fatty liver. So this was all about the fatty liver slide. You can confuse it with any slide of the liver. And most common confusion is with alcoholic steatohepatitis slide. When we will cover that, I will also tell you the differentiation between the two. But also I will also make dedicated videos telling you the differentiation between the most confusing slides. So stay tuned.